And despite that drop in dose numbers, state health officials scrambling to find ways to administer vaccines to hundreds of thousands of people across the state. They say the demand is high and they're struggling to keep up. This is Katie Turner, heard from doctors. She joins us live. Katie, new research showing South Carolina one of the worst states when it comes to getting vaccines out.
Yeah, Brendan. In fact, the latest data ranks South Carolina as 48 out of all 50 states in vaccine administration. State health officials say they are doing everything they can to speed up the process, but right now, managing demand is their biggest challenge.
A slow and steady vaccine rollout has South Carolina among the bottom spot in the nation.
We are certainly doing our best to try to vaccinate as many as possible.
Pressure is rising to get hundreds of thousands of shots into the arms of South Carolinians.
There are two constraints. One is, how much vaccine do we have? And the second is, how many team members do we have to do the vaccination?
DHEC officials say they are aware of the state's ranking, but are unsure of the accuracy.
We are in communication with the CDC and Operation Warp Speed to verify that information, that data and those numbers are correct.
Amid rumors of wasted vials of the vaccine, state health leaders say they are administering nearly 100% of the allocated doses from the federal government.
Not seeing any significant numbers of doses being discarded or wasted.
Health leaders across the state stepping up their vaccination efforts, making sure those without internet or residents of rural areas get their doses.
The FQHCs, many of which are in rural areas, will receive vaccine beginning the start of this coming week.
Doctors at the Medical University of South Carolina say they're vaccinating about 3,000 to 4,000 people per day.
Our goal is to get to 10,000 vaccines a day, assuming the vaccine supply allows for that.
In the meantime, those waiting for their turn can help keep hospital beds open.
It's going to depend on everyone's behavior in South Carolina, and we really need everybody. This is a critical point in time. We need everybody to double down on their efforts.
DHEC says the state is moving towards the start of Phase 1B, which would open up vaccinations for school workers and more first responders. Next Wednesday, Federal Healthcare is opening a vaccine clinic offering first-come, first-served vaccines to people in Phase 1A, including healthcare workers and people in long-term care facilities. We have more details over on CountOn2.com. For now in studio, I'm Katie Turner. Count on 2.